Good morning.
Good morning, Barbara. Hey, thanks for joining us. You saw a video probably a few weeks back of Tom with his tennis elbow where we gave an injection, and I realized looking at this previous video of a patient who had the same problem as you but didn't get better with conservative treatment, that we really didn't talk about conservative treatment. What is conservative treatment? Well, we'll talk about it now. So Barbara, you've had soreness here in the past. Right?
Yes, 25 years ago.
And it was treated with an injection?
Yes.
Responded very nicely?
Well, they did 2 injections, and the first 2 didn't work, but the third one, when they went way inside,
okay,
and that hurt really bad, and that third one just seemed like cleared it up right away.
Okay, all right. And this has come back now for the last 3 weeks?
Yeah, 3 weeks, after I had a terrible fall.
But it was after the fall?
It was after the fall.
Definitely after, not right after.
No, it was like 3 weeks after the fall, it started hurting really bad.
Okay, and the pain is occurring right here, not where the elbow prominence is, what we call the olecranon, but rather up here,
exactly,
where there's a bony prominence that is one of the forearm bones that comes up here.
Exactly.
And when we push on it,
yes,
it's a little tender right there. I'm not pushing really hard.
Right, yes, tender. Right there, exactly.
Okay, so what we want to do is take the strain off of the tendon here. We have tendons at both ends, so go like this. Is that a little tender, just
yes, a
with
little
no weight
bit
or anything?
A little bit, yes.
Okay, so we want to take the strain off of a muscle that goes from here to here. There's tendons at both ends, and if we can isolate all the pulling to this side of the tendon, it shouldn't be pulling over here anymore. So I'm going to go 2 finger breadths from the elbow crease, which is right about here. And then I'm going to press on that. Is that a little tender?
It's a little tender.
Let me go a little forward. How about there?
It's not quite as much.
Okay, now move your wrist back and forth. How's that feel compared to?
Actually, not much, not bad.
Okay, and then if I take off, is it a little sore?
Yeah, it's that.
So that makes a difference too.
Exactly.
So now all the pulling's over here. This part's just kind of anchored against the forearm bone, not pulling on there, and that gives you a rest.
Okay.
From the strain. We'll do that for a few weeks to try to avoid having to give a cortisone shot.
Okay, yeah.
Because it's better not to give the shots.
Okay.
Because there's complications with it. You can get an infection from shots. It hurts to get a shot.
Oh, those things, yeah, that last one hurt. It went way into the...
Yeah, and you can also get some discoloration of the skin, which we actually may have seen on the last patient. I don't know if it showed through on the video, but the cortisone can discolor the skin. It makes it a little lighter in color, so that's another risk of that procedure.
So I won't have a beautiful elbow then.
It is a permanent discoloration, so we do try to avoid that. And there's techniques we use to try to keep the cortisone from getting in the skin and keep it deeper. Also, there's risk to the tendon. If somebody was to give the shot wrong and actually get the needle in the tendon and inject it, which is actually kind of hard to do. You have to try to get it in. They can injure the tendon, and it can even rupture in really extreme cases. More of a problem with the Achilles tendon than elbow, but we'll not get too much into that.
Okay.
So we'll give that a try.
All right.
If it's not getting better after a few weeks, we'll have you come back and we'll give the shot.
Okay.
But
sounds wonderful.
I'll write a prescription for the band. If I had one, I'd actually show it here. But we'll go ahead and get that.
Okay.
All right. Thank you so much for doing the video with us.
Oh, no problem. I appreciate you having me here today. I love coming here to see
We're glad to have you back, Barbara. How long have you been a patient of mine?
Well, I think probably about 6-7 years, and then the last 2 years I was gone, and now I'm back. I mean, I got new insurance, and I'm so glad to be back.
Were you my patient at the other location?
Yes.
I mean, in downtown Auburn?
Oh, no.
Not that far back. Okay.
Not that far back.
Okay.
Not that far back.
Thank you so much for being a part of the video. We're glad that you joined us. Hey, if you like watching videos like this, be sure to subscribe. You can get extra behind the scenes content on Patreon if you want to click on that. Until next time, share with your friends. Barbara and myself telling all of you to stay in good health. Thanks, Barbara.
Thank you.
So let me send that.